So Avergent was born several years ago. Over the last 20 years, we've seen increasingly high deductibles, out-of-pocket expenses. Medical bankruptcies are the leading cause of bankruptcy. These statistics and more really caused me to take a look in the mirror and say, can I continue to do things the same way, getting such a terrible result? Unfortunately, what gets lost in the way that our industry looks at the core problem is that we're focused on not the patient. When you actually hear the stories of what healthcare costs have done to people, that people have had to declare bankruptcy because of a healthcare event that should never happen in a country like ours, but it has. So Avergent was really born out of the market necessity. In order to deliver better results in the market, we really have to challenge the status quo. Employers, they run a healthcare business and they have not run their healthcare business well. It's a huge expense, yet they don't have the data, the information, the tools, the resources to manage that sector of their business. What the employer needs to know is not just how the tools and the pieces come together, but ultimately how organizations like Avergent and our plan partners, how we're going to help them manage the risk that sits inside of their population from a health perspective. In healthcare, the majority of patients do not have the tools to be a consumer. Healthcare is not something that you consume like anything else. The message to the plan member is relatively simple. If we can give you the clinical tools and resources that you need to make the decisions that are going to get you the best possible care outcome, and we're going to remove the financial barrier, those high deductibles, those hefty out-of-pocket expenses, if we can remove that for you, would that help you be a consumer? The majority of the employers that we serve now deliver plans that don't have deductibles anymore, that we've seen not only insurance premiums not rise by double digits, but in some cases we've seen them decrease by double digits. And we've seen people's lives saved by just simply getting them the right diagnosis and treatment plan. Our mission is first and foremost to educate without any strings attached. And then ultimately that spirit of partnership, that education that you've gained, and that courage that you're going to show is ultimately what makes you the hero in restoring the American dream by fixing the healthcare system. To be recognized in this way with as many employers as are part of the Alliance, as many entities and organizations and people that are involved with the Alliance is a very humbling thing. And I can't say enough about the Alliance recognizing that. It means an incredible amount. And honestly, what I hope for the most is that this is just one more springboard in the market getting behind what transformative health plans can ultimately do for the plan member.